think you know, or people do here know my background. I'm a CPA. I have some auditing experience. I do take the budgeting process seriously. What they had brought up to me is somewhat troubling. I know you tried to explain it, but when you're a $500 million over in what we have budgeted, I think that's problematic. And I struggle with it. And I think it's also hard to tell Pennsylvanians that, hey, we've spent that much. It makes us look irresponsible. And I wish we had better control over that, because we have our own households, we have to do that. But there's something even, to me, that's even more problematic in this, and it has to do with the rolling cost of future years. It's when we're only paying 11 months of a bill instead of 12, and we have the medical assistance capitation program. There's $133 million. The community health choices is $131 million. That's a rollover from costs of other years, and we have the community waiver program, which is about $44 million. That's $308 million. So we have a $500 million overspend or a supplemental appropriation already, and then we have this. We're rolling nearly $308 million into 2021. So when I look at the numbers, this tells me that the supplementals of about $500 million, in addition to this amount, that the true number is almost $800 million. Am I wrong in my thinking on that? And why would we? And I guess I'm asking too. Why roll? Why roll that? I mean, here's the other thing I do want to say, and somebody alluded to this. We actually have a good economy, and revenues are coming in. I understand maybe deferrals when things are tight, we do it in our own households, but to me, this is a problem. Thought maybe you could expound on that.
We put forth the budget, of course, and it is reviewed by the governor's budget office, and they make certain decisions, I'm sure, and I don't want to put words in their mouth, but looking at the overall budget. And these are some things, and you're right, just to go step back, it is about $800 million if you put those back into it. Those adjustments are made, I believe, for cash flow reasons. I don't know exactly. You'd have to speak to the budget secretary about that. But you are correct. So we're more than willing to bring them into this year if we get what we need to pay them.
Well, like I said, I do think it is problematic when you add them in when we have a healthy economy. But then here's something else that gets a little bit tricky too. The proposed budget appears also to include 11 months. We're only paying 11 months for community health. This is in addition to that. We have this situation where we're delaying 1 month of payments, which reduces the state funds by that's $388 million. Mm-hmm. So I guess my question would be, so now we're, in addition to those rules, now we have this situation, which I think is unusual too. And I guess my thinking is, are we planning to make 13 payments then in 21-22, or is this going to be a permanent delay? I mean, are we just going to keep running in a situation where we completely delay our payments on this?
This is I hate to say normal, but we do this in capitation, where we roll some payments into the next year. We haven't done this in the past with CHC, but CHC is a new program. So this is something new for CHC this year, but it is not an unusual practice.
I understand that, but I also understand the economy we're in now. And then I want to come kind of full circle. I know Representative Grove had made a comment to start this hearing out. So we add the $493 million, almost a $500 million requested in supplementals this year, and the $1.2 billion requested for 2020 and requested for this year, and the $388 million payment delay. That's $2 billion in additional state funds for DHS. We're talking $2 billion. I guess, and as Representative Rothman said, we do have a responsibility to taxpayers too. Absolutely. I mean, these are significant dollars. I'd like to know, are these amounts going to be sustainable? I mean, like I said, I have an accounting, I'm a CPA, I have an accounting background. I try to look at these numbers. I mean, I'm troubled and I'm worried about whether we can continue to roll this forward, because I do think people, they're looking at the legislature, they're also looking at the governor to have fiscal responsibility. I mean, what are your thoughts on that?
Yeah, I mean, I think this is why our cost containment efforts are so important and why we're so focused on them. But as I've said before, I mean, I do think the issue of an aging population and people who are outliving their resources is a major, major issue. And again, these are people that we have to be there for. They're people who have paid into the system their entire lives, but we're all living longer. When I was at the insurance department, one of the issues I was really focused on was the long-term care insurance market, partly because I understood that with that market basically kind of collapsing, it meant there was less private dollars going to pay for long-term care services, and that meant more load on Medicaid. And I think, you know, at the time, what I was trying to figure out is could we tweak the products available in the long-term care insurance market so that at least there was more private money going into the system. And unfortunately, that market is still not doing well. So people are living longer. They are outliving their resources. We're seeing higher acuity people. And these are people that we're here to serve. So that's our job and it's our role. I certainly understand your concern about our budget growth.
I was going to say, I do think the residents of Pennsylvania are pragmatic. They understand that there needs to be a safety net to help people, but they also expect us to have financial responsibility. And I'm just laying that out. These numbers are staggering for us. So thank you for being here today. Thank you, Mr. Chairman.